I want to welcome Katie Buitrago, who's the Director of Research at Heartland Alliance. They published the annual report on poverty, Illinois, and Veronica Cortez, who is a staff attorney at the Shriver Center on Poverty Law. And both of them will start our day helping to give us a larger understanding of the cycle of poverty in the communities that you will serve over the summer. So I will pass the baton to Katie.
Thank you, Brent. Can everyone hear me okay?
Yep.
Great. It says that I can't share my screen, Brent. It says it's disabled screen sharing.
I'll fix that.
Thanks. While we work on that, I can just introduce myself. I'm Katie Buitrago, she, her, hers. I am the Director of Research at Heartland Alliance, which is a large anti-poverty and human rights organization here in Chicago. We do a very broad range of interventions, from supportive housing to healthcare for people experiencing homelessness to legal services for immigrants and refugee resettlement and things like that. But in addition to the many direct services we provide, we also do systems change work. So our research department is housed within the research and policy team. We have state policy staff who are lobbyists in Springfield, a national policy team, and our research team that does policy research, program evaluations, needs assessments, just trying to give decision makers better information about what they need to make decisions about programs and policies that are working to end poverty. It looks like I can share my screen now, so I will go ahead and do that in a second. Do folks see the presentation? Thumbs up, okay, cool. So I'm here today to talk about our annual poverty updates that we put out. This is part of the information we try to put out there to help policymakers understand poverty in their communities, as well as nonprofit leaders, philanthropy, and things like that. We found that, people might think that there's not poverty happening in their backyard, but as I'll show you, poverty is a pressing issue throughout Illinois. And so the latest data on poverty, which is from the Census, reflects 2018. And it shows that there's still a significant number of people living in poverty in Illinois. Almost 1/3 of Illinoisans are poor or low income, and 1.5 million Illinoisans, or 12.1% of the state, live in poverty. What we mean by low income means that you're living on a household income that is 2 times the poverty line or less. Extreme poverty, which means having income below half of the poverty line, it remained the same for the 2nd year in a row in Illinois and is now at 5.6%. And although poverty rates in Illinois have returned to pre-recession levels, the percent of people in extreme poverty remains above pre-recession levels. Almost 700,000 Illinoisans are extremely poor. And like I mentioned, this reflects American Community Survey data from 2018. There's always a lag between when the data are collected and all the processing that needs to happen to when they're released. And so many of the realities on the ground are likely very different now because of the coronavirus and the high unemployment rates that are happening, but we won't know exactly what those numbers look like until late next year. And so when I talk about living in poverty, that has a very specific meaning within the context of the census. So this is what the federal poverty thresholds look like. It's the same nationwide. It does not take into account cost of living where you live. It doesn't vary by location. So for a family of 3, it's living on about $20,000 a year. And when we talk about extreme poverty, that's about $10,000 a year. So when you're thinking about your ability to support yourself in a city like Chicago, we're talking about a pretty extreme measure of deprivation. And so when I talk about some of these figures about what percent of different groups are living in poverty, this is what that means. And how the federal government comes up with this is pretty wild. Basically, the poverty line is the cost of food in the 1970s multiplied by 3 and adjusted for inflation. So it doesn't take into account things like housing costs, healthcare costs, childcare. It doesn't vary by location, like I said. There is another measure that the census puts out called the supplemental poverty measure that does take all these costs into account. However, it's not typically what is reported on when looking at poverty rates. The benefit of sort of using this, the official poverty rate, is that it allows you to make longitudinal comparisons over time and make comparisons across geographies and things like that. But it doesn't actually accurately reflect what it takes to support a family. In the Chicago area, MIT puts out, well, nationwide, MIT puts out estimates for what a living wage would be. And for a family of 3 in the Chicago area, it's about $70,000 to meet basic needs. So it's, over 3 times as high as the federal poverty line. So how does Illinois stack up compared to other states? So again, Illinois' poverty rate is 12.1%, and there are 18 other states nationwide that have a lower poverty rate than Illinois does. So we're about in the middle in terms of poverty compared to the rest of the United States. So looking at poverty rates over time, for the first time in 2018, poverty rates in Illinois returned to pre-recession levels. But nationwide, poverty rates dropped below pre-recession levels. So Illinois is essentially a year behind the nationwide average in recovering from the 2008 recession. So one factor that Illinois had that sort of sets it apart from the country in negative ways was that the state budget crisis that we had a few years back. We went over 2 years without a state budget, and people experiencing poverty in communities of color, which there's often significant overlap, bore the brunt of this man-made crisis. And many vital programs were already reeling from years of underfunding, had to cut services or close their doors entirely. And that put the health and safety of Illinoisans with the fewest resources at risk. And so this could contribute to the delayed recovery from the recession compared to the rest of the nation. And so even though the poverty rate is bouncing back from the recession, median household income has not. The median household income in Illinois was not statistically different from last year, and it's about $65,000. And this follows several years of income gains. And this indicates that the growing cost of living, as reflected by inflation, is eating away at income growth in Illinois. In addition, when you look at nationwide data on income gains are not equally distributed throughout our society. Households in the highest fifth of the income distribution earn over half of the nation's income, compared to 3.1% of the income in the lowest fifth. And when you look at this, in 1967, 50 years ago, the top 20% of households earned just 44% of the nation's income. So over time, income inequality is becoming more stark in the United States. And economic growth is largely benefiting those who already have the most resources in our society. And looking at poverty, it's not equally distributed throughout the state either. Poverty rates are 1.7 to 3 times higher for Illinoisans of color. 8.4% of white non-Latino Illinoisans are poor, compared to 24.8% of Black Illinoisans and 14.6% of Latino Illinoisans. We also break it out here by race, age, and gender. Black children in Illinois are 3.9 times more likely, and Latino children 2.3 times as likely to live below the poverty line compared to white children. You can see that the poverty rate for Black children is 35.4%. And again, remember, this means they're living in households, if it's three people, of about $20,000 a year. And the poverty rate for Latino children is about 20.4%. Here we look at it by, we sort of take the age dimension out of it and look at it by just race and gender. In Illinois, Black women experience poverty at a rate that is 3.5 times higher than white men, while Black men's poverty rate is 3.1 times higher, and Latino women's poverty rate is 2.2 times higher than white men. And poverty is often thought of as an urban problem, but the share of the Chicago region's poor in the suburbs has grown substantially between 2008 and 2018. In 2000, about a third of the people in poverty in Chicago region lived in the suburbs. Today, it's about half. And it's important to note that in the Chicago region, poverty rates in Chicago are still much higher than they are in the suburbs, but in terms of trends, the real growth is in the suburbs. And this phenomenon where central city poverty rates have stayed relatively stable, but poverty has skyrocketed in the suburbs, is happening throughout the country. So it's not just a Chicago trend that's occurring. And you can see from this map that some of the highest poverty rates are outside of the Chicago area. The top 5 poverty rates in Illinois are actually in southern or central Illinois. Looking at Alexander County, with nearly 28% of people living in poverty. And so finally, in our updates, we also look at health insurance coverage. And for a long time since the passage of the Affordable Care Act, we saw increasing rates of health insurance coverage. But for the past 2 years, we started to see small declines in health insurance coverage rates. And this shows that the historic gains in health coverage made possible by the Affordable Care Act have slowed and are now reversing. And this is deeply concerning and suggests that the unrelenting opposition to the Affordable Care Act and public programs from the federal administration is taking a toll. And also in Illinois, the effects of the state budget crisis affected the enrollment capabilities by our human services sector. There was also a new electronic eligibility system launched in late 2017 that had continued to have significant problems into 2018. And so this led to a backlog of thousands of cases for Medicaid and a spike in inaccurate cancellations of coverage. So all of these factors in Illinois could contribute to higher rates of health uninsurance. And almost all of the people who lost Medicaid in Illinois were in the Chicago 6-county area. And I just wanted to share a couple of resources with you that we put out there. If you wanted to dig in more detail about poverty in specific communities, we have data dashboards. Do you see my web browser, or is it still on the PowerPoint?
Still on PowerPoint.
Okay. Let me see if I can change these settings. Okay, I think that should do it. But we have an Illinois dashboard as well as a Chicago dashboard looking at poverty and a bunch of other trends. These are about to be updated in the next month, so they actually have the previous year data. But we have Chicago community area level indicators. So looking at, this is the poverty rates for Chicago. And there's a bunch of other stuff in here. So like extreme poverty, unemployment, educational attainment, home ownership and rental rates, healthcare indicators, and as well as a lot of detailed educational indicators as well. And you can also see when you click into the dashboards about specific topics, you can compare 2 communities to each other or compare a community to the Chicago average and see, you know, this one shows how Albany Park is stacking up compared to Chicago on unemployment rates. And then at the state level, it's a state map looking at a lot of these same indicators. And you can also see it in a tabular form if you just are interested in getting an overview all in one place about well-being by county. We also put this out in a fact sheet form. So if you just want to have this handy when you're going out and doing your work, we have the latest trends on poverty here. And then finally, we put out our annual report on poverty in Illinois, which our newest one is coming out next month. And it's looking at the effects of having a criminal record on people's lives sort of after their engagement with the criminal legal system has ended in terms of employment and housing and other barriers. And last year we looked at gender inequity and poverty. So this takes more of a look at poverty and how it interacts with other issues. And, you know, tries to make the case that, you know, the causes of poverty might not be what people think. And so I'm happy to, I can see if there are questions, or I can just pass it over to Veronica. We could take questions after. I don't know if you have a preference, Brent.
Maybe let's pass it to Veronica and then have everyone's questions to the end.
Sounds good.
Great. So can everyone hear me?
Yes.
Great. So I'm Veronica Cortez. I'm an attorney at the Shriver Center, as Brent said. And to give you all a background on what the Shriver Center does, it's been around for 50+ years. We do work mostly in Illinois, but also nationally. We like to say that we use every tool in the toolbox. We do policy and advocacy work, as well as litigation. And our policy work is done at the county, city, and state level. We also run several multi-state networks of lawyers and community leaders nationwide to bring some of the work together. And how our work relates to poverty is all of our work is around people that are living in poverty. And something that Katie mentioned is we've come to the conclusion that you can't separate poverty from race. Right now, the way that our systems are set up in this country is that they are tied together. And so our new tagline as of this last year is for racial and economic justice. So that is what we're working on. That is what we're working towards at the Shriver Center. And so that looks like, you know, how are we targeting or how are we helping more women and children? How are we looking at how programs or issues are targeting immigrants in the United States or in Illinois? And so we work in 4 key areas, and we've broken them up into economic justice, which is how, what are our safety net programs and how are they serving Illinois and Illinoisans? How is the public charge rule that's come up in, it's an immigration rule and comes from the federal government, how is that being applied to our folks here in Illinois? And so through that, like we have advocacy and we do work across the state on like SNAP, TANF, WIC. So SNAP is food stamps. TANF is temporary, it's called temporary assistance for needy families, and it's a small amount of money a person can receive or a family can receive monthly for a max of 5 years. But there are a lot of onerous requirements to receive that money. And so what we work on is how do we make it easier for families and for folks to access these services. And so we work in coalition with many different organizations, including Heartland Alliance. And so that's our economic justice. Like how are we helping people access these services and making it easier for people to access these services? And so in different instances, we've had to file litigation, or we do the advocacy in Springfield. For the public charge rule that came down from the federal government, we filed litigation in Illinois. There's lawsuits across the country, and we've been coordinating with folks across the country on what that strategy is. But we filed a case here, and it's moving forward, and hopefully, maybe we'll be able to stop this rule from being implemented. Again, our economic justice, we work on getting people paid sick days. That has never been more important than what we're facing today, right? This pandemic has shown us that people need paid sick days. We are working on and had high hopes for this year in January for paid family leave for the state of Illinois, because we know that is also important. And when we talk about women and children living in poverty, we know that women not having access to paid family leave, when they are normally the caretakers, really affects their ability to make an income. And so paid family leave, ensuring that there are 6 to 12 weeks of paid leave when a person delivers a baby, that they are able to that will help uplift them in terms of their ability to earn an income. And we worked on and continue to work on raising the minimum wage, because as Katie described how poverty how we decide what poverty is and is not, we're not our minimum wage of $7.25 an hour federally doesn't really reflect what people need to what people need to earn to be able to survive in this country and to not live in poverty. So you could work 40 hours a week at $7.25 an hour and not make enough money to pay rent or buy food or anything else. And so we understand that, we see it, and we work on how to help fix that. And so that's a bit of our economic justice. We also do, one of our other teams is community justice. We work on things like, why are so many people of color across the state of Illinois, or specifically Chicago, getting so many parking tickets that they have to declare bankruptcy? When we look at how people are ticketed in the city of Chicago, why are mostly people that live in communities of color receiving the most tickets? And so that, and then that escalates to people lose their driver's licenses and now they can't work. And so our system of ticketing folks in Chicago, but across municipalities, across Illinois, and across the country really, are driving people into more poverty. So if someone was making it or just barely making it and now loses their driver's license, now they're not. Now they're further in poverty. How those same court fines and fees drive people into poverty. And then we also look at, how does the child welfare system work in the state of Illinois? And how many parents have their children taken from them simply for issues of poverty? Not issues of abuse, not issues of neglect, but simply issues of this family or this household doesn't have everything that they need to keep, is not being served by the state or by the community, right? And that's why kids are being taken away. And so those are the issues we're looking at on our community justice team, as well as how do we help people re-enter society when they're exiting or when they finish serving their prison sentence. And so what are we doing to help people not re-enter the criminal system? What are we doing to help people find housing? What are we doing to help people? How are we allowing them or not allowing them to access the public services and the social service programs that we have in the state of Illinois? And then we have our health justice team, and they work very closely with Heartland Alliance on a lot of things, including how do we make the insurance enrollment program more smoother and better. And we have had to file litigation in that instance as well. A few years ago, we filed a lawsuit because kids were turning 1 year old before their Medicaid application was being processed. And so if we think about health insurance and access to health insurance in this country, and how important it is, especially for small children that have to see the doctor quite regularly, we are not, but we have a program that's funded through the federal government, through some state dollars. We're not actually giving kids these health insurance cards in time for them to actually use them in their first year of life. And so that was something where we had to file a lawsuit against the state to get them to make this a priority. And yes, there were a lot of things, right? There was the budget impasse and there were a lot of things going on, but we could not afford to let the state ignore these folks and these children and adults as well that were not able to access a service that they qualified for quite a long time. And so that's one of the parts of the health justice team. And then generally, how do we insure everyone? How do we get everyone to be insured? How do we raise enrollment rates? As Katie said, the enrollment rates are starting to drop. How do we help raise those rates for folks? And then this year, we actually did have a minor success in Springfield. And as soon as the governor signs it, crossing all of our fingers, we will have coverage for people that currently don't qualify for Medicaid that are 65 and over and at 100% of the federal poverty line. So looking at seniors that, again, are at the highest risk today of not being able to get health and highest risk today of everything that's going on in COVID-19, the COVID-19 world, but also that don't have access to health insurance today in any way. And so those people will be covered now. And so that's one of our health justice successes of this year.
Veronica, just to clarify, that includes undocumented seniors too, right?
Yes.
That's
Yes,
so
that
exciting.
Which right now have no path to health coverage. And then we have our housing team, which focuses on several different things, including right now helping to stop evictions or stop evictions is the big thing right now. But then also, how are we? Also our housing team has had to file litigation to help stop or change laws across the state for nuisance violations or that are the nuisance violations or laws that are put into place are actually very much or very often how do I phrase this? They're put into place to be discriminatory, but not to say that they're being discriminatory. To how do we get rid of more people of color from this city is we pass a nuisance violation. And so we've had to file lawsuits across the state. Right now we are in the process of either deciding we're going to trial or settling a case in Peoria for nuisance violations where they clearly were trying to get rid of their Black population or trying to make it as difficult as possible for them to live there. And so that's one of our cases. As well, and then on the policy side, trying to figure out how do we maintain the public housing available in Illinois that already exists? How do we make it bigger? But then also, how do we make it easier for people to afford housing and stay in their housing or find housing? And so something we've been working on over the last couple of years has been considering sealing eviction from sealing evictions from those background checks, especially because the way that evictions function right now, someone could not actually be evicted and had no actual problems, but there's a record, something on their record. I don't do housing law, so this is an area where I'm just trying to briefly give you guys an overview of that. But that is a real problem for folks, and to be able to find housing and affordable housing. And so that is our last team that I would like to discuss. And so that is like the picture of our work in terms of how we're looking at things. How are we trying to move the needle a little bit on our economic justice team, in some ways, like move the needle to get more people out of poverty, but also make sure that those people that are living in poverty right now have what they need, or as much as we can give them of what they need. So I think now I'm ready for questions, unless Brent, you'd like me to talk about something else.
No, that's great. So if anyone has any questions, add it to the chat, raise your hand, unmute yourself. I say that with some trepidation to 130 people, but. Someone be the first.
Maybe we were just extremely clear.
Yeah. Well, maybe Katie and Veronica, here's one. To Katie, why is the federal government using data from 50 years ago to set standards on poverty?
Yeah, that's a good question. So the justification from the census is that they want to be able to continue to make comparisons over time, so they don't want to change the poverty measure. The thing is, it also is used to determine eligibility for a lot of public benefits programs. And so there's been a lot of advocacy from the human services sector and from the anti-poverty sector to update the federal, the definition of the federal poverty line. And so the census did release a supplemental poverty measure, but that's not used for determinations of public benefits or anything like that. And there are some programs where they are considered a little bit differently, but sort of a standard, like looking at HUD programs, for example, they often look at the area median income and sort of what percent of the area median income you make in determining your eligibility for housing programs. But, there's some pros, I guess, to keeping it in order to continue making comparisons over time. But I think when it comes to determining who can get access to benefits, like we should really look at, the cost of living and who's able to meet that cost of living and not.
Other questions? I know it's hard on a huge chat, but Katie and Veronica, maybe will you talk about the kind of time that we're in right now? I think some people see like opportunity with changes that could be made that would impact kind of poverty, globally in the United States. What are kind of the biggest things that could be done that would make an impact?
I could start just with the caveat that I'm not from our policy team, but like a lot of the discussions that I hear them having, looking at, for example, something they've been pushing for is universal basic income, and just trying to use this experience of, there's 20% unemployment, but we want people to stay at home in order for public health. This is like a perfect justification for why we might need basic income. So they're just trying to use this awful situation as a chance to sort of show like these sort of injustices and inequalities existed before the COVID crisis, but it's just sort of making them more stark and more apparent. And I think it also illustrates a lot of problems with job quality. People who are working low-wage jobs that might be deemed essential or still having to go to work are often Black and brown people, and so they're at higher risk of contracting the virus as well. So our policy team is trying to use this situation to advocate for benefits, increased access to benefits, and improvement in job quality. So that's and also housing is illustrates a huge issue with housing and people experiencing homelessness who are living in what they call congregate settings, like shelters. It's a huge risk for spreading the virus. So trying to really push for getting people housed and using some of the stimulus resources to create housing opportunities for people who are unstably housed, and to really take a racial equity approach to that, because the virus is not experienced equally by every community. When you look at the percent of people who are dying from coronavirus in Chicago, Black people are about 70%. And the percent of people in Chicago who are Black is about 30%. So it's over twice as high in terms of disproportionality. And so we need to make sure that we're targeting resources to the most impacted communities. So that's some of the things that our policy team is thinking about. Veronica, I don't know if you want to add.
I think we echo a lot of the same things. I think last year, did anyone think that there would be a bipartisan package to get everyone $1,200? And that, I mean, in some ways we're excited about that, in the concept of the universal basic income, that everyone needs to make this threshold of money to survive. And if they're not making it, that government has to stand in. But I think, I don't know that we feel the momentum now or today that we did maybe 2 months ago or at the beginning of this, but universal healthcare. Really, I mean, I think this crisis has really made us think that we need it in this country, and that our healthcare system doesn't necessarily work for this sort of situation. And so, or for a situation like this that could arise and will continue to arise possibly. And so I think we felt that there would be more of a shift towards maybe towards universal healthcare. I don't know that we're feeling as optimistic today as we were when this first started, that it just felt like there was more energy and movement towards it. Paid sick days, we really thought we'd actually get at least through the state for everyone, considering what has happened, and that people need to be able to stay home if they're not feeling well so that they don't spread a disease. And legislative session just ended and we were unable to get it through. And so I mean, there's still hope that something may change in the next couple of months, and there will be more movement towards something like universal health care and universal basic income, as well as paid sick time. But yeah, we'll see.
So another question in the chat, which I appreciate everyone using the chat for questions. The Census Bureau recently announced a shift in the 2020 census timeline to delay the release of data to the states. Do you have any concern about the impact of shifting that timeline on disproportionately undercounted populations?
Yeah, I mean, I think that there's a general concern about the effect of the virus on the census count, because the census is super important in terms of determining political representation. Illinois is likely to lose one representative and is at risk of losing a second one if there's an undercount. It also determines allocation of federal funding to the states. And it's just, the census can't, in good conscience, do the kind of door-to-door outreach that it typically does to increase the count. They're still pushing for it. It's the first year that you can fill out your census online, which can increase access for some people. But it is a concern that, people have a lot of other things on their minds. And we don't have all of the efforts that you might normally have in a census year to be able to increase outreach. So yeah, I'm concerned about what it means for Illinois, and especially for historically undercounted populations. And this, already going into this year of the census, there was a lot of concern about the citizenship question, which didn't end up being on the census, but there was enough sort of public debate and concern about it that I think it really damaged trust with immigrant communities. So we sort of went in at a disadvantage for undercounted populations, and now there's sort of this added barrier on top of that.
Veronica, do you have any thoughts on that from a legal perspective?
No, I think you covered it, Katie. Yeah.
So this one's to Veronica. How do you approach and advise community members who are kicked off of government benefits because they get a slight raise or new job with slightly better pay, but it's still not sufficient amount of money to truly live without those benefits that they lost? Does this just keep the cycle of poverty going, since you're penalized if you try to better yourself or make more money, but you also remain in poverty if you don't try to make small steps, take small steps to make more money?
The answer to the second question is yes. And it's a real problem, and it's what we like to call the public benefits cliff. You make $1 over that set amount and you are off everything. And the different programs do have different, so some of them are 135 of federal poverty, 100, 200. But yeah, you make $1 more and you're off all benefits, and we don't, and so that's something we've advocated for, and we will continue to advocate for, is a staggered drop off of public benefits, so that someone that is making $1 more maybe receives half of the benefit, whatever it is, but also maybe has time. Instead of being immediately cut off, has 3 months, has 6 months. We've achieved a little bit of that in the early childhood system. We have a program called the Child Care Assistance Program, which is some federal dollars and state dollars to help pay for childcare. And that is a real cliff, simply because sometimes families are receiving $1,000 a month in assistance for childcare. And the moment you make that $1 more, you lose that $1,000 a month. And we first have managed as a state to raise the level of who qualifies for that program to 200% of the federal poverty line. And we've also made it so that you have 3 months at the back end if you make more money than that, to like kind of fall off of it. But there's a lot more work that needs to be done across all of our systems, because people are, as you mentioned in this question, people are turning down raises or turning down overtime, turning down extra income that they could have simply because they can't afford to make that $4 or $10 more, because they'll lose this $1,000 or this, $500 in food stamps or whatever it is that they're receiving, which $500 is a lot. Most families are not receiving anywhere near $500. But people do or are forced to make that decision between making a little bit more money, which could help them, and not receiving any more help, which they can't survive without. It's a tough situation folks are in.
And how do you approach and advise clients with that information?
I think different people in my office would have different answers, but you do sometimes tell them that ultimately we can make that decision for the clients, and we do lay out what the options are. If they do make 50 cents more per year and that knocks them off, is it worth that 50 cents? And do that cost benefit analysis of, if you're making 50 cents more an hour and that throws you over, what does that equal to a year? Can you survive off of that? What does the opposite look like? But we definitely hear the stories of people turning down raises and turning down overtime and turning down extra work that they could be doing for this. And I don't think there's a right answer. And there's no right answer for every single individual. It's each individual having to decide for themselves whether or not they can afford to go to lose their benefits.
So another question in the chat kind of brings in this conversation with the disability community. So are any of the organizations, what kind of work are they doing with the disability community, and then particularly with the disparity between the poverty line and benefits from SSI and SSDI?
The Shriver Center does not do work with the disability community because there's an organization that already does that work. And so we may partner together to do some advocacy, but we don't do, and especially in terms of like SSI and SSDI and that intersection, and the poverty line, I'm sorry, we don't work directly within those programs. And I don't know if Heartland is doing any work.
I don't know on the policy side. I mean, I know we have human services programs that serve people with disabilities, like a lot of our housing programs and things like that. But I'm not sure that it's a big focus for advocacy work, but they do partner with groups like Access Living to advance their agenda around poverty.
Can you talk about the impact on poverty and people with disabilities, and in any data that you have with that connection?
Yeah, I don't have the numbers off the top of my head, but people with disabilities often face significant employment barriers. If you look at the surveys that people have, you see a lot of self-reported instances of workplaces that won't make reasonable accommodations, even though it's a legal requirement. If you look at the data of poverty rates disaggregated by disability, there is a much higher rate of poverty among people with disabilities. And so if you look at our report on poverty from last year on gender and equity, there's also a section on the intersection of gender and disability in poverty. And so women with disabilities in particular have an even higher poverty rate.
Veronica, we have a question that asks if Shriver's criminal justice team is considering kind of similar arguments that Katie described with race correlations between COVID and the impact for incarcerated populations. Can you speak to that for?
Yeah, some of our advocacy during this pandemic has been around releasing people from jail, considering how people are packed together in a jail and how people are at risk. And so, and as part of a coalition with a few other folks, there has been a lot of advocacy around getting people out of jail, and the how race correlates with COVID has definitely been used and will continue to be used in all of our advocacy. Yeah.
Katie, are there standards for poverty on a state-by-state basis? Kind of talking about the differences between what $20,000 might be in California versus Arkansas. Can you speak to that?
No, the poverty line is the same everywhere in the country. So it's the $20,000 for a family of 3 in California and Arkansas and New York, Chicago. So yeah, it doesn't make a lot of sense, but that's how it is.
I think that those are all the questions in the chat. Did I miss anyone, or did anyone want to mute themselves even and ask a question? Maybe let's talk a little bit about the impact of the criminal justice system and poverty. Katie, do you want to kind of speak to that? And then Veronica, that was kind of an interesting with COVID, but just kind of in general, poverty and how that correlates with communities that are more impacted by hospital incarceration.
Yeah, so we've done a couple of research reports looking at issues that are directly related to the criminal legal system, or things that are parallel to it, like high incidences of violence. And there's a lot of overlap with poverty rates, specifically looking at violence. Poverty can be both a predictor of violence as well as a result of violence engagement or living in a community with high rates of violence. Because there's trauma is sort of the missing link between the two. Trauma can make it harder for you to find a job and to keep a job or to complete your education that would allow you to get a better paying job. And also just looking at women who go to prison, for example, they typically have much lower incomes before entering prison than men do, or than like the overall state median income. And so, you know, a lot of people end up in prison due to crimes of survival, they call it. So it's property crimes or drug-related offenses that are not necessarily violent, but you know, that might be related to the similar causes of poverty. And once you're incarcerated, that's many years that you're out of the labor force. And so that's sort of missing job experience that makes it harder to get a job. And most people who are incarcerated return to the community, over 90% do. So there is, you know, you have to plan for that return and that reintegration. And so there's many barriers to employment once people come back from prison. One they mentioned is missing years of work experience. One is just the stigma of being incarcerated. Or, you know, there's over 3 million, this is a scoop of our new report, over 3 million adults were arrested or convicted of a crime in Illinois. And so that's a lot of people who have a criminal record. Only a small fraction of those have actually been to jail or prison, but having a record can, in and of itself, can be a barrier to employment because they show up on background checks. If you are working in a job that requires a professional license, like the healthcare industry or even the cosmetology or things like that, there are barriers to, they can restrict your ability to get a license because of your criminal record. And so that, you know, inability to find employment is a huge, you know, it's very closely related to poverty rates.
And there's also, along with the employment, there's also a movement right now to ban the box on job applications, the box that says, have you ever been arrested or convicted of a crime? Because that automatically will weed people out of the application pool, or that the people accepting the applications will weed people out because of that. And like Katie said, not everyone actually went to jail. Not everyone, it's not always relevant. And so there's that movement. There is an effort by groups also to figure out how to make that reentry smoother and more easy for folks. We are now automatically enrolling folks in Medicaid, or supposed to be automatically enrolling folks in Medicaid when they step out of prison, to also have a continuum of healthcare access. Right now, for our Temporary Assistance for Needy Families program, if you have a drug conviction, you don't qualify for that program. And so a lot of the folks, a lot of the people that are coming out of prison with drug convictions are women and their mothers. And so we're saying to them that they can't take care of their children, or receive funding to take care of their family, just because they have a drug conviction. And so there's been movements across the state, across the country, and maybe here eventually, to get rid of that, because of how it disproportionately affects women and mothers.
There's similar barriers for public housing as well. If you have a drug conviction, or if someone in your family has a drug conviction, you can't get access to subsidized housing.
So with just a couple minutes left, what do you both kind of see as like the biggest impact that students can make with a legal career, with communities? Because I guess, I mean, I know that there's so many, but what do you think is something like a good next step for folks who are interested to be doing this type of work?
I would say dig in to what you're interested in. Like, if you're, whatever office you're working in, if this is what you're interested in, figure out how to make that your work, how to make those projects your projects. If your office that you're working in this summer doesn't have a type of program like that, figure out how to volunteer or do some work in your next semester. But if this is what you're interested in, working in this section of the law, get in there. Get as much experience as you can doing this type of work. And you can do it in a bunch of different ways, right? And I'm sure Brent will have someone either today or in one of these sessions that does direct legal services, because that also gives you a whole different scope and a whole different way of looking at things. And so and some of you are working at direct legal aid, legal services. And so you have, like, the best way to get into this work, or to make this your work, if this is what you're really interested in, is to get in there. Find a way to get into the work, find a way to make the connections. And if you're not doing it this summer, set up virtual coffee chats with folks, email people, ask Brent who he recommends. Not to add more work to your plate. If this is what you're interested in, he's got a lot of contacts in Chicago. If you're interested in doing this in California or in another state, look around and figure out who you can have virtual coffee dates with, so that you can build a relationship and get into the work that you want to be doing. That's honestly, that is what you have to do. Try to get in there.
One final question. Pilar asked this. What what goes into the strategic thinking in thinking of how to make an impact? What's the process of deciding whether a lawsuit is the right impact versus policy reform?
It's not always either or. Sometimes it's both and. Sometimes it's what's feasible. Sometimes there's no legal case to be made. or a case has already been brought and it didn't work. And so then your only avenue is policy, or sometimes you have the opposite. You've tried really hard with policy because it would be faster. The problem with litigation, and I'm a trained litigator, so it's hard for me to always say this, is it's so slow. Your relief may take 15 years to come. And with policy, you can change things possibly in a year, possibly in 2 or 3. And not to say that a lawsuit won't change things faster, but I've worked on too many lawsuits that take so long that I didn't start the lawsuit. I'm just at the end of it. And so that's kind of where you have to balance, like, what could we possibly achieve via policy? Could we possibly achieve it faster and more comprehensively? Because we ultimately don't know what we're going to get from litigation. What is a judge going to rule? Is that judge going to decide that only this chunk of this is problematic, even though you think, or the world thinks, all of it is problematic? And so sometimes you do both. You file a lawsuit and you file litigation at the same policy at the same time, and you hope one of them will move faster. But yeah, I think there's no real answer other than sometimes it's both. Sometimes it's just speed, or what you hope will be a more speedy outcome.
Great. Well, thank you, Katie and Veronica, for giving us a good introduction to poverty in Illinois. And so I guess silent claps from everyone who's muted, but we all really appreciate you.
Thanks
for having us.
Yes.
Thank you.